Assalamu alaikum and welcome to Ramadan for Better Health. We do appreciate you tuning into the program and hope that inshallah you're being very successful during the fasting month of Ramadan. May Allah accept our efforts. Today for our health topic, we're going to be discussing a very ubiquitous problem throughout the world, diabetes. We're joined by an endocrinologist and also a consultant in diabetes. This is Dr. Arafat El-Shabrawi. Salaam alaikum to you, doctor. Thank you so much for being with us to talk about diabetes. Let's talk about what it is. How do we categorize diabetes? What are the causes of it?
Okay. Bismillah ar-Rahman ar-Rahim. Start, I'd like to express my deepest thanks for all Huda TV members for their kind invitation to join you today and to join your program today. When we speak about diabetes, it is a metabolic problem because to understand diabetes, I prefer to ask ourselves, what if we don't have diabetes? Normal persons. Normal persons have a hormone secreted by pancreas called insulin. This insulin is responsible for glucose metabolism to blood glucose lowering, and with handling of glucose we eat during meal. During fasting hours, liver act as a glucose which is produced to produce glucose to maintain steady blood glucose level.
And this word glucose, a lot of times when we talk about diabetes, people, they actually call it sugar. I've got sugar, or my mom has sugar. Is this why is it referred to as sugar? Is it?
No, diabetes is disturbance in metabolism of the sugar, not directly equivalent to the word sugar. So if you have diabetes, you have one of two problems. I usually stimulate insulin like the key, and glucose like guest for our body. Insulin go to the cells and opens the door by this key for glucose to enter the cells to be metabolized, to produce ATP, or to produce energy. If you don't have this key, you have insulin deficiency. You have what's called type 1 diabetes mellitus. If you have this key, but it's not acting well, it's proper, it can't open the door, so you will have what's called type 2 diabetes, which is usually occur in elderly, occur in about fourth and fifth decade of life, but type 1, which is insulin deficient, usually occur in the second decade of life and in early childhood also.
I really like your illustration, the insulin serving as a key.
Yes.
Right? And it can open the door to allow the sugar or the glucose to come in and do its job. Or you have the key, the insulin, but it doesn't work properly.
Yes.
Right, okay. Did I also hear you say that there was a relationship between insulin and the production of insulin and the thyroid gland? Or is there a connection to the thyroid?
Thyroid put initiate most of the metabolic process in our bodies. Insulin has special job specified in glucose metabolism. It's the main hormone responsible for glucose handling. If we eat more, we have excess glucose, we have excess insulin from pancreas. If we eat less, we have less insulin to make some sort like a balance between the blood glucose level and the insulin level.
All right, so we as Muslims, we're obliged by Allah to fast during the fasting month of Ramadan. Let's talk about people who have diabetes, they're Muslims, they want to fast. Do they run the risk of hurting themselves by fasting for 15, 16, 17 hours a day?
Yes. As you said that we have obligatory order from Allah to fast during Ramadan, but some people who are ill or traveling during Ramadan are exception from this order. So a diabetic patient, fasting may be beneficial, and in some other occasions may be hazardous. So fasting may be beneficial as regarding weight loss, decrease the glucose stress on our body, so the patient will work well. But at the same time, especially in children or type 1 diabetes, it may be hazardous because it may lead to the serious complication called hypoglycemia. It's a sudden decrease of the blood glucose level, which may be actually fatal complication, and in other occasions may lead to hyperglycemia. So it may lead to hypoglycemia, may lead to hyperglycemia, may lead to impairment of renal function in some occasion, and so on. So diabetic patient, fasting may be beneficial and may be hazardous. So we have certain rule, important rule, which is individualization for fasting. Before fasting Ramadan, we must seek medical advice in the diabetes clinic to see it's proper for me, it's appropriate for me, it's beneficial for me to fast, or I am excused by the Holy Quran from fasting during Ramadan because it carry potential hazards or risk for me.
Yes. Okay. So it depends. The short answer is it depends on the specific way that diabetes functions in a particular patient, and they should be working with their doctors to decide. No one should be deciding with themselves, I'm going to fast or I'm not going to fast, right?
Yes.
Okay. So what kind of, once a diabetic a patient does decide in consultation with the doctor they're gonna fast Ramadan, what kind of advice going into it do you have for them?
Actually, at first we must note that fasting during months of Ramadan have two aspects, religious aspect and the medical aspect.
Okay.
So this make it very important that the physician or diabetologist know the medical aspect and to some extent the religious aspect about fasting during Ramadan. So the Fiqh Academy degree started to defining diabetic patient during fasting or for fasting the holy months of Ramadan to four main categories. This is very important for all our patients listening to us today to know what category I belong to.
Okay.
I am category 1 or category 2, in which fasting is not preferred at all, and we advise all our patients in category 1 and category 2, which has very high risk or high risk during fasting the whole month of Ramadan. They are not allowed, they are advised to not to fast at all, because there is very risk if you fast. But category 3 and category 4 not allowed to break fast. They must fast because fasting here may carry potential benefits and nearly no hazards of fasting. So you may ask me, what's the category 1? What's category 2? Yes.
Yeah. No, we're not talking about type 1 and type 2. We're talking about groups of people
Yes.
who are deciding with their doctors whether to fast or not to fast.
Okay. I speak here about categories. I'm not speak about types.
Yeah.
At first, type 1 is classified as category 1. Type 1 is classified as category 1, for which, for whom fasting is not preferred.
Okay.
But other people which belong to category 1, like patient has severe hypoglycemia during the months preceding month of Ramadan, patient has frequently have hypoglycemia or hyperglycemia. I remember you that this is the Fiqh Academy decree decision about fasting, not my own opinion or expert endocrinologist
This is
opinion.
an international
Yes,
standard.
yes, this is a connection between the Islamic or the religious part of fasting and the medical part of fasting. Again, they states that category 1 include severe hypoglycemia during the 3 months before Ramadan, patient with frequent hypoglycemia, patient has with hypoglycemia unawareness. I mean here that there is a patient who has hypoglycemia without any warning symptoms. We usually learn or educate our patient that if you have tachycardia, if you have marked sweating, if you have a sense of fatigue or hunger, this means that you have hypoglycemia. But some patients have what's called hypoglycemia unawareness, have no symptoms. This is very risky to fast during months of Ramadan.
One term that you use, tachycardia.
Yes.
What is that? Something with the heart?
Rapid heartbeats.
Rapid heartbeats. Okay.
Also in category 1, patients have difficulty in controlling diabetes for long periods. Patient with diabetic ketoacidosis or hypoglycemia during the 3 months of preceding Ramadan. You may ask me, what's diabetic ketoacidosis? This is the hyperglycemic coma or hyperglycemia leading to a decrease of the blood pH, which is called acidosis, which is also potentially reversible, potentially fatal condition. Okay. Also include acute illness associated with diabetes, patient with renal dialysis, pregnant ladies, and all patients with type 1 diabetes. These are category 1.
Dr. Arifa, I'm sorry to interrupt you. You're going through all the details about these different categories, 1,
Yes.
2, 3, 4, right?
Yes.
So we're eventually going to get to all 4. We're going to take a short break and come back with Dr. Arifa with our discussion on diabetes.
Welcome to Cosmic Proof, the one and only program that leads you to the truth wherever it is, for my sake and your sake.
Assalamu alaikum and welcome back to Ramadan for Better Health. We're talking about diabetes. Some of us, brothers and sisters, Muslims who want to fast during the fasting month of Ramadan, we're discovering that it may or may not be beneficial. It may be hazardous. We're joined by an endocrinologist and a diabetic consultant, Dr. Afra El Shabrawi, to open up our understanding of this. Before the break, you were giving us
these 4 different groups to determine whether or not to fast if we have diabetes. Can you, before you continue, give us the names or the titles for each of these 4 groups? Yeah, the first you said was
Category 1, very high risk.
High risk.
Of serious complication if fasting during months of Ramadan.
Okay, high risk.
Category 2, high risk of complication. Category 3, medium risk. Category 4, low risk.
Okay,
So
simple
we have
enough.
very high risk,
Very high.
and the high risk I mentioned belong to category 1, and now move to category 2. Patients who have poor glycemic control, such as blood glucose level more than 180 milligram per dl, or more than 10 up to 16 millimole per liter. High glycosylated hemoglobin, more than 10. You know that glycosylated hemoglobin give idea about the last 3 months of diabetes control. Patient with renal impairment, patient with macrovascular disease, and those live alone and treated with insulin injection. Patients suffer of conditions that add additional risk. Elderly people with other associated comorbidity or co-diseases.
These are the 7.
Yes. These 7 patients or 7 categories belong to category 2, which is also not referred to fast during months of Ramadan. But category 3, with medium or moderate risk, which has patient well-controlled diabetes on oral hypoglycemic drug or on insulin, and this has medium risk or moderate risk. Category 4, which is carry low risk. This patient with well-controlled on diet or only the simple medication called metformin or non-hypoglycemic drugs. Okay?
Got it. Okay, very good. So we have the specialists who work with diabetes have created these categories to help the doctors and the people understand whether or not they should fast for Ramadan. Yes. All right. So there's a question I want to ask you that I didn't ask earlier about the numbers of people worldwide who have who have diabetes.
Diabetes is actually the most common worldwide endocrine disorders, and one of the most common causes of death worldwide. Belong to the 5 common causes of death worldwide. So diabetes is worldwide pandemic, affect many population worldwide.
So it's right up along with the cancers, heart disease, all these kind of things. You have diabetes as one of the 5 top killers of human beings.
Yes, actually it is independent risk and independent cause, and also cause all it's incorporated in pathogenesis and in etiology of most of the diseases you mentioned before. You mentioned coronary artery disease. Diabetes is a major risk factor for coronary artery disease. You mentioned cerebrovascular stroke. brain injury.
injury, vascular brain injury. Diabetes is a major risk factor for this vascular brain injury and so on.
Ah, so this is not a precursor, but it could indicate, if you have diabetes, one of these other top four.
Yes, but not to make our patient on this, but if your diabetes is well controlled,
Yeah.
you are nearly protected like all others. But if your diabetes is not well controlled,
Yeah.
you are at a major risk. So from this point, we take a good point to advise all our patients worldwide, especially our Muslims diabetic patient, to take care of their diabetes, to take the medication prescribed at times, to take care about their diet and so on.
Okay, so we've been talking about diabetes. The traditional, the gold standard, is it the insulin injections? Is this the way to manage it, the condition?
Okay. Actually, we have different lines of treatment of diabetes. I just categorize to type 1 and type 2. For type 1, the insulin is the main line of treatment up till now, and all other future therapy we hope that will near times become fact, like stem cell transplantation and all others, but up to now, insulin is the main line of treatment. And here, as we are in the holy months of Ramadan, patients type 1 are not advised to fast, but if decide to fast, please refer back to your doctor to plan fasting. So planned fasting has less risk than non-planned fasting.
Yes.
Okay?
Yes. Okay.
This is for type 1. For type 2, we have oral medications plus intravenous medication or insulin. This oral medication, I'd like to simply classify for our patient into two main categories. It actually, on the scientific basis, it many categories, but for our patient, I simply will classify it into two main categories. Categories which has high risk or risk hypoglycemia, and other group of medication which has less risk hypoglycemia. So we have metformin,
We have DDB4 inhibitor or acarbose. These drugs carry less risk of hypoglycemia, and so these drugs are preferred during fasting the months of Ramadan. But other drugs like sulfonylureas, like insulin itself, carry high risk of hypoglycemia, so it is not preferred to use it during months of Ramadan. And if you take any of these medication, you must again back to your physician, back to your diabetologist to ask how I deal with this medication and when we approaching the months of Ramadan.
Okay, let's talk more about research, modern efforts to better understand and create new remedies, the different medical organizations and institutions. What kinds of work, where does the future hold for diabetes and diabetic patients?
Yes, this is an excellent question, because I was in a conference 1 week ago. We speak about what's called smart insulin. I think it will be a new era in diabetes, which is insulin joined to another substance which make it inactive despite if the blood glucose is high. So it's like a glucostat. If the blood glucose is high, this insulin will be active and if low, it will be inactive. If this actually occur, it will be new era. It will be a very good line of treatment for all diabetic patients to have this what's called smart insulin.
Smart insulin.
Yes.
So do the scientists, do they have a timeline when they expect 1, 2, 3 decades from now?
I think it may be about 5 years or more, not less than 5
All right.
years.
So they've actually started trials already?
Yes.
Okay. Well, it looks like there's a lot for us to look forward to, and this could effectively make performing Ramadan easier for Muslims if we do have the smart insulin.
Yes.
Okay. All right. One other question I wanted to get to in terms of the understanding diabetes itself. It's connected to the endocrine system and malfunctions of it. Is there a relationship between diabetes and the immune system?
Yes. Actually, immune system may play a role in pathogenesis of diabetes, especially type 1. In one of theories, type 1, no definite etiology up till now, but one of the most important theories that it's immune mediated, or the presence of antibodies which attack beta cells of pancreas, destroy it, make it unable to secrete insulin. So there's a relation between immune system and diabetes.
I see. And this occurs the inside the liver itself, attacking the insulin, or is that where it happens? You said that there was a part of the insulin or that is attacked by the immune system. Where does this happen? In the bloodstream or in the...
No, in pancreas.
The pancreas, okay.
Yes, the main manufacturer of insulin is, or the manufacturer of insulin is beta cell in pancreas.
Pancreas, okay.
Yes.
All right. Well, Doctor, anything else before we close the program that we haven't touched on that you think is important before we end the program?
I think I hope all our brothers worldwide to enjoy the month of Ramadan, but please visit your physician, diabetologist before the holy month of Ramadan. Please, if you take diet regimen for diabetes, continue, never mind. If you are on metformin, take it and continue your fasting, never mind, but just modulate the dose to take the main dose after iftar, and half the dose after suhoor. For example, if I take 3 tablets of metformin, 500 milligram, I take 2 tablets at iftar and 1 tablet at suhoor. If you take sulfonylureas, please take it before iftar, not before suhoor, because it's carry high risk of hypoglycemia. If you are on insulin therapy, take your ordinary dose before breakfast, before iftar, but take half the dose before noon or suhoor.
Dr. Arifa Shabrawi, thank you so much for this very important advice to the brothers and sisters who are fasting Ramadan, and thank you for being with us. He is a consultant in the area of diabetes and also an endocrinologist. Thank you for tuning in. We hope this was beneficial for you to help you have a more successful Ramadan, inshallah. May Allah accept our efforts. Assalamu alaikum wa rahmatullahi wa barakatuh.